Should dogs really be taking heartworm medication every month for their entire lives? Some people say absolutely yes. Others claim the medications are more dangerous than the disease itself. So what does the evidence actually say? That's what we're talking about today. A viewer asked this question a few weeks ago, and honestly, it's one I've heard for years from thoughtful dog owners. Because if you care about your dog, eventually you start asking harder questions, not just what am I supposed to do, but why am I doing it? And part of the reason this conversation gets so heated online is because people often get pushed into two extremes, either never question preventatives or all preventatives are poison. Reality is usually more nuanced than that. So today we're going to look at what heartworm disease actually is, how prevention medications work, the real risks and side effects, whether natural alternatives actually work, and how I personally think about the decision for my own dogs. But let me say this up front, I am not a veterinarian, and this is not medical advice. My goal is simply to help you ask better questions when you talk to your own vet. First, let's understand the disease itself. Heartworm is a parasite spread through infected mosquito bites. Once inside a dog, microscopic larvae slowly migrate through the body over several months and eventually grow into worms that live in the heart, lungs, and surrounding blood vessels. And these aren't tiny parasites. Adult worms can grow up to a foot long, and dogs can carry dozens of them. Left untreated, heartworm disease can cause lung damage, heart failure, exhaustion, chronic coughing, and eventually death. Now here's the part many people don't realize. Heartworm prevention doesn't create some invisible shield that blocks infection. Your dog can still get bitten by an infected mosquito. What the medication does is kill the larvae early, before they mature into adult worms. That timing matters. Because once a dog develops adult heartworms, treatment becomes much harder on the dog than prevention ever was. Treatment usually involves multiple injections of a strong arsenic-based medication, months of strict exercise restriction, risk of complications from dying worms blocking blood vessels, and often costs thousands of dollars. Even after successful treatment, some dogs are left with permanent heart and lung damage. So from a purely medical standpoint, the case for prevention is very strong. Organizations like the American Heartworm Society, the American Veterinary Medical Association, and the FDA all recommend year-round prevention for dogs in the United States. But, and this is important, those are broad recommendations. Your individual dog's actual risk depends on where you live, mosquito prevalence, your climate, whether you travel with your dog, and your dog's lifestyle. The highest risk areas are the southeastern United States, places like Louisiana, Mississippi, Alabama, Texas, and Arkansas, where mosquitoes thrive almost year-round. But low risk doesn't mean no risk. Heartworm has been detected in all 50 states, and cases have been increasing in some traditionally cooler regions as temperatures warm and mosquito seasons expand. So this is where the conversation becomes less black and white. A dog living in coastal Louisiana faces a very different risk profile than a senior dog living in a colder northern climate with a short mosquito season. That doesn't automatically mean prevention should stop. It just means the risk calculation changes. Now let's talk about the medications themselves, because this is where a lot of confusion lives online. Most heartworm preventatives use drugs from a class called macrocyclic lactones. Common ingredients include ivermectin, milbemycin oxime, and moxidectin. At FDA-approved preventive doses, these medications are considered very safe for most dogs. But no medication is completely risk-free. Reported side effects can include vomiting, diarrhea, lethargy, reduced appetite, and in rare cases, neurological symptoms like tremors or coordination problems. Severe reactions are uncommon at preventive doses, but they can happen. There's also a genetic mutation called MDR1, found most commonly in herding breeds like collies and Australian shepherds, that can make dogs more sensitive to certain drugs, especially high doses of ivermectin used for other parasites. The good news is that the low doses used in heartworm prevention are generally considered safe even for most MDR1 dogs. Still, it's something worth discussing with your vet if you own one of those breeds. Now let's address one of the biggest questions I see online. Can natural alternatives prevent heartworm? The honest answer is that there's currently no peer-reviewed scientific evidence showing that herbal or homeopathic products reliably prevent heartworm infection. Garlic, black walnut, essential oils, diatomaceous earth, none have been proven in controlled studies to kill heartworm larvae effectively. That doesn't mean natural approaches can't support overall health. But specifically for heartworm prevention, FDA-approved medications are currently the only proven option. And if someone chooses to skip prevention entirely, they need to understand they are accepting a real risk of infection. Regardless of what you decide about prevention, though, one thing should not be optional: annual heartworm testing. Even dogs on prevention are typically tested yearly because missed doses happen. No product is 100% effective, and catching an infection early matters enormously. If you choose not to use preventatives, regular testing becomes even more important, because by the time symptoms appear, damage may already have begun. So how do I personally think about all this? This is actually my third dog, and my thinking has evolved over the years. With my first two dogs, I followed the standard recommendation completely: monthly preventatives, year-round, no questions asked. But as my dogs aged, I started having more nuanced conversations with my veterinarian. I live in an area with relatively low heartworm prevalence compared to the southeastern US. My older dogs were seniors, rarely traveled, and spent most of their time close to home. So together with my vet, we looked at the local risk, their age, their health, and my commitment to annual testing. And in the last years of their lives, we made the decision to stop preventatives. Not because the medications were toxic. Not because I fell down some internet rabbit hole. But because for those specific dogs, in that specific situation, we felt the risk-benefit balance had shifted. And I want to be very clear here. There is no good published evidence showing that standard heartworm preventatives cause cumulative liver or kidney damage in healthy dogs. That claim gets repeated online constantly, but I have not seen strong evidence supporting it. My decision was not a scientific indictment of the medication. It was simply a personal risk decision made with veterinary guidance. And interestingly, with my current dog, after another honest discussion with my vet, I made a similar decision again. Because of the relatively low risk in my area, the fact that I don't travel with him to high-risk regions, and my commitment to never skipping annual heartworm testing, I decided not to use year-round prevention at this time. And I understand many veterinarians would strongly disagree with that approach, especially in moderate or high-risk areas. That's fair. I'm not telling anyone else what they should do. I'm simply showing you how one owner thought through the decision with veterinary input, instead of blindly following internet opinions on either side. And honestly, that's probably the biggest takeaway from this entire conversation. The goal shouldn't be fear. Not fear of heartworm. Not fear of medication. Not fear of questioning things. The goal should be informed decision-making. Ask your vet how common heartworm is in your area, whether seasonal prevention is reasonable where you live, whether your dog's age or lifestyle changes the recommendation, what happens if you miss doses, and how important annual testing is for your situation. Because thoughtful owners can arrive at different conclusions, as long as those conclusions are based on evidence, veterinary guidance, and an honest understanding of the risks involved.